I'd like to give a shout out to our newest sponsor, Fog King Sanitizing and Disinfecting. Do you have a positive COVID-19 case at your workplace or residence? Need some cleaners to come in and blast the shit out of their area? These are the guys to do it. So go to fogkings.ca and get yourself a quote, reach out, and they'll be back to you in no time. I'd like to take this opportunity to thank my sponsor, Rycor Countertops. They deal in custom countertops in quartz, corian, magonite, laminate, and butcher block. They also have custom kitchen cabinetry, closets, laundry rooms, and millwork. They're family owned and operated for 18 years, knowledgeable and highly experienced staff, and friendly customer service. Head on over to 1069 Clark Road. Check out their showroom today. I'm gonna ask you that again once we get started, as soon as I introduce you. But basically, in a nutshell,
is this going to be live? So is this live?
No, we're recording, so we can.
This is recording.
Yeah,
okay,
we'll record it and we can send it to you for your approval before we air it. So I just wanted to. Dr. Faisal is a very good friend of mine, and when I spoke to him about. He was getting his vaccine and we were talking about all this stuff, and I said I wanted to talk to an infectious disease doctor because I just wanted to clear up all the rumors and give people some sort of ease in this vaccine and ease and some hope and something to look forward to. So I wanted to talk to a professional and not some Joe Blow online who says that you're going to get microchipped. And you know what I mean? So I just wanted to clear that up, and I wanted to have a good quality content, and Faisal highly recommended you, and since Faisal's my brother, I trust everything he says, so I'd like to get you on and we can just talk about it.
That sounds great.
And I won't hold you up too long, but my producer's here as well as Dara, and we're pretty much good to go. So I'll introduce you, and then I'll try not to keep you too long.
We have till about 2:45 roughly, so it's not too long, not too bad.
No, but that's okay.
I have another meeting at 3, so if it creeps up a little bit more, that's okay.
Yeah, well, I'll do my best to squeeze everything in and kind of get through this really quick. So I'm going to get going here and we'll get started. Welcome to Studio 88. Today, my special guest is Dr. Samir Elsayed. He's an infectious disease doctor at the LSHSC here in London, Ontario. I was referred to him from Dr. Faisal, who's a very close friend of mine, and basically wanted to have you on to talk infectious diseases, COVID-19 in particular, and vaccines and all that stuff. If you can just give us a quick rundown of your credentials, that'd be great.
Okay, thank you, Jamie, for inviting me to this podcast. So I'm a professor of medicine and pathology and laboratory medicine at Western University, and I hold certifications in infectious diseases, medical microbiology, and internal medicine, and I also have training in healthcare quality as well. And I work primarily at Victoria Hospital, but I generally do cover the other sites as well, University Hospital and St. Joseph's Hospital. I'm on a number of committees in the hospital as well. We're very busy during this time, like everyone else is.
Okay, so let's kind of dive into I want to talk about the vaccine, and that's kind of the first step. I mean, the world is well aware of COVID-19 and how its effect on people and how it's now the vaccine that's being rolled out. People are nervous, people are scared, people are worried that there hasn't been enough testing, there hasn't been this, there hasn't been that. Can you put us at ease and kind of walk us through the whole vaccination process and how it works and kind of what went into it?
Right. So in terms of managing the current pandemic with COVID, we have a number of things that are considered public health interventions. And obviously, we know about these because we're doing them. So social distancing, hand washing, wearing masks, etc. Those are strategies that are used for other infectious diseases, not just for COVID. But because of the duration and severity of the pandemic, vaccines were looked at as a strategy to help manage the unprecedented pandemic that we're having right now. And no one had expected that we would have a vaccine available by the end of the year, by the end of last year. And so there are a number of vaccines actually that are either being studied or that have been approved. So we have the Pfizer vaccine, and we also have the vaccine from Moderna. Those are two vaccines. The Pfizer one is given usually over a period of 3 weeks, and the Moderna one is given over a period of 4 weeks in terms of two shots that you get. Now, these vaccines were developed over a very short period of time relative to how other vaccines were produced in the past. And they're using a fairly novel technology. And so these are called mRNA vaccines. They haven't been used in large-scale applications in the past, but they have been trialed before. Mm-hmm. And I guess there's concerns that perhaps can the vaccine cause a problem in the future? Will it cause some sort of health problem many years from now? As you've heard in the news, some people have developed allergic reactions or severe allergic reactions. Mm-hmm. And in general, these reactions are very rare. They're perhaps slightly more common than allergic reactions with other vaccines, but they're not very frequent. They get a lot of media attention. Now, these vaccines, in the studies that were done to get these vaccines approved by both the American Food and Drug Administration and Health Canada, these vaccines have demonstrated what they say is, anywhere between 90 and 95% protection. And those numbers are used in a certain context in terms of how well they work. It doesn't mean that if you don't get the vaccine, you have a 95% chance of getting COVID. Mm-hmm. It just means that the vaccine, in a standard population at risk for COVID, the vaccine will reduce the risk of COVID by 95%. So that's what that means. So if your risk of COVID is 1 in 1,000 without the vaccine, your risk of COVID with the vaccine is 1 in 100,000 almost, or 1 in 95,000 if you want to put it that way.
Okay. Those are good numbers.
So, yeah.
Now, how is this vaccine any different from, say, like the flu vaccine? So with the flu vaccine, they give you a strain of the flu, correct?
Yeah, so the flu vaccine is developed in a different way, but the flu vaccine contains 3 or 4 strains of influenza. They're usually, the ones that we get are usually the inactivated forms. There is a live form that they give intranasally. Mm-hmm. But the flu vaccines are developed on an annual basis based on what's circulating around the world. With COVID-19, with COVID-19, the vaccines were developed in a different way. And again, it's the technology used is different than what has been used before. But it's been found to be safe. Now, they haven't done kind of the in-depth animal studies that are often done with other vaccines before they come to market, or with any kind of drugs. Whenever a drug comes to market, there's usually an animal safety component that's done before it gets inoculated into humans. But in the trial participants that led to the approval of these vaccines, and also amongst many in the general population, the vaccines have been shown to be fairly safe. Long term, we don't know. I mean, it's a new vaccine. We will have to do kind of a surveillance and analysis of all the vaccine recipients over a course of time to find out if there's any long-term effects. But again, it's a risk-benefit analysis, and there's an individual component. It shouldn't be, forced upon anyone to get these vaccines. It would have to be an individual decision. Although governments may require these vaccines, who knows? Mm-hmm. For you to board a plane or to travel or to do this kind of work or that kind of work. We don't know. There are some limitations of the vaccine, which I can discuss.
Limitations, like what do you mean?
So the COVID, when COVID first started in November, December, there was this kind of strain of COVID, or a genetic form of COVID that was circulating in China, and then it spread around the world. And then in January and February of 2020, another kind of mutated strain of COVID was noticed. And then by June, that strain kind of took over the world, and it took over from the other strain that was, or the other variant, I guess, that was dominating for the first few months of the pandemic. So basically, we started out with a certain genetic form of COVID in November, December, and that was dominant for a few months, but then that was overtaken by another form of COVID, a mutated form of COVID. And you may have heard in the news where there was a wave of COVID in the winter, spring of last year, and then perhaps in the summer, the COVID cases were more severe, perhaps maybe in some parts of the world. Mm-hmm. And some people speculate that it might be due to this other mutated form of COVID, or variants of COVID. Now, subsequent to that, you probably heard in the United Kingdom, there's this United Kingdom variant of COVID.
Mm-hmm.
And also recently, there's been description of a South African form of COVID or variants of COVID. These have genetic mutations in the virus's genetic material that may be responsible for increased transmission, maybe increased severity of illness, and maybe resistance to the vaccine. So when we inject these vaccines, we're hoping to have immunity produced, and the vaccines were made based on the COVID that was initially circulating around the world. These new variants have mutated their genetic material such that they may evade the immune response that's produced by these vaccines. Now, people looked at the United Kingdom variant and found that it's unlikely that the vaccines won't work. We do believe the vaccines will be effective, but there have been studies done, very limited studies, and not like big research studies, but more single patient or groups of patients where the vaccine, or at least the immunity from the vaccine or the immunity from natural infection, if you take the antibodies of someone who's recovered from COVID and try to neutralize the South African variant form of the virus, may not be effective in that regard. So there's concern right now, basically, that the South African variant that was just detected in November, it was reported in December, that South African variant may or may not be responsive to the vaccine or may be minimally responsive to the vaccine.
Mm-hmm.
However, nevertheless, vaccination overall is presumed to have more benefits than risks. If you look at everything and what's going on everywhere, people are dying of COVID.
Mm-hmm.
And certainly if someone can benefit from the vaccination and they make an individual choice to choose the vaccine, I would say that the risk benefit is low. So basically the benefit would be high for many populations, and the risk would be low. Now, if someone has a history of a severe allergic reaction to medications or other things, they may not wish to take the vaccine because those individuals may be at risk of having an allergic reaction with the vaccine. I mean, you can't predict that.
Mm-hmm. And now, as an infectious disease doctor, when you see the government with all the lockdowns and all the restrictions that they're putting on society these days, do you think they're doing the right thing, or do you think they should go? See, in my personal opinion, I think a full lockdown where nobody moves would be the best solution. But that's just, my fear, saying like the best thing to do would be nobody moves until this thing disappears and then we come out of our caves. How do you feel about that as an infectious disease doctor? Do you think what they're doing is just prolonging this thing, or like, what's your take on it?
Yeah, so there's a lot of controversy about lockdowns. Now, in Australia, for instance, they had a very strict lockdown policy. Now, Australia being an island, a large island,
mm-hmm.
it was a lot easier to deal with COVID. And they dealt with it early on with a very strict lockdown. Their measures were considered draconian by some. But basically, if you ask someone from Australia now, do you have any COVID? They're going to say, no, we hardly have any COVID at all in the country.
Mm-hmm.
Same thing with New Zealand. Now, these are islands again. If you look at Taiwan as well, if you're looking at island nations, they had COVID early on, but they dealt with it with a very strict lockdown early on. And many of these places, people are living normal lives. People are not prohibited from going anywhere. But in Canada, it's a little bit different. The geography here is very different, as it is in places like the United Kingdom and elsewhere. To enforce a lockdown in a country the size of Canada is very difficult. And I personally believe that the lockdown measures being implemented by the government, even though obviously they're well-intentioned and believed to be effective, I don't think they're as effective as they think or as other people think.
Mm-hmm.
The main way for a lockdown to be effective is if you have a very strict or complete lockdown. And at the same time, the residents within that geographic area have to be compliant with social distancing and personal protective measures.
Mm-hmm.
If you don't have your population using masks or socially distancing themselves from others, your lockdown isn't going to work. And the other thing, too, is that we still have flights coming from other nations into Canada. And many of these international travelers when they come into Canada, they're asked to voluntarily quarantine for 14 days. But no one's really monitoring that very closely. And so people can possibly violate that requirement to quarantine, or if they have symptoms, to self-isolate. And so that's the difficulty with lockdowns. Lockdowns will only be effective if everyone follows the rules and if we tighten our international borders. Now, we've done that by automobile at the Canada-U.S. border for the most part, but we still have healthcare workers moving across the border there. So, Essex County right now has the highest rate of COVID amongst the entire province. And Lambton County, where Sarnia is, has the second highest rate per capita. So you can see that trans-border movement is really a big part of the rise in the number of cases of COVID. And so the lockdowns themselves will not be very effective or will be minimally effective if we don't tighten our international borders.
Mm-hmm. Which blows me away that they don't, because you would think as a country you would say we need to take care of home first before we start letting people move about. And I know, I just don't understand why they keep the flights going. It makes no sense to me.
Yeah, some places. So, for instance, there was a ban on travel from the United Kingdom because of this new United Kingdom variant that's circulating, which we have in Canada already, and it's found in many countries around the world. It's already crossed continents, etc. But it doesn't seem to be resistant to the vaccine. It may be more transmissible. We don't know, and some places have decided to lift that ban. I think, I can't remember for sure, but I believe one of the Canadian provinces had a ban and they just lifted that ban recently. For South Africa, many places are putting bans on travel from South Africa because the South African variant is the one that has the potential to not be responsive to the vaccine. So even if they do widespread vaccination, it might not protect you against this variant. And then the other thing is that many of the less wealthy populations or countries don't have access to the vaccine like we do. And so that's going to be a big concern because COVID-19 is an international fight. And if you don't have all countries have equal access to the vaccine, the pandemic isn't going to go away completely right away. And so that's going to be a big factor.
Now, is it normal for infectious diseases to mutate so rapidly?
Yeah, so like other viral pathogens, like influenza, like other viruses that we encounter, mutation, or what they call genetic evolution, is a normal phenomenon. So what we are seeing with COVID, with the initial strain or the initial variant, some people say we shouldn't call it a strain, but with the initial genetic form or variant that was circulating, that was eventually replaced by another one, and then we have the UK variant, and we also have the South African variant. This is not unexpected. A lot of times these mutational changes happen when the virus enters a person or an animal, and perhaps they might get infected with a second strain of a virus, or something happens when viruses are moving through humans and animals over the course of time. Mutations do happen. Now, there is a variant of COVID-19 that was related to mink, so the mink animals in Denmark. This variant infected a few people who were handling mink, so mink handlers, and it has affected other mink farms around the world. It's even affected mink farms in Canada and elsewhere. And so this is called the Denmark or the Danish variant of COVID-19. Denmark actually culled or killed their entire herd of mink, which was about 17 million.
Wow.
So they decided to do that because they were worried that the vaccine was not going to be effective against this variant, even though there is no evidence to suggest that. There was one report that showed perhaps maybe an infection with the mink variant might not work, or might not respond to the vaccine, or might not be prevented by the vaccine, but there's no big study that really shows that. So many people are concerned that Denmark basically obliterated their entire mink industry. And recently there was a farm in British Columbia where a herd of mink were infected, and they decided to cull their entire or almost entire herd of mink. I need to verify how much mink were were called there, but you can see how challenging it is. It's kind of like how avian influenza was, where people kind of decided to call their entire herd of chickens out of concern that this variant of influenza would spread amongst their flock, or especially to humans. So this is kind of like what's happening with COVID-19 in some ways.
That's crazy. I have another question for you.
Yep.
In regards to influenza, now the cases seem to be, they're drastically low this year. Why do you think, I mean, I've read it's because the COVID-19 people are testing positive, but really it's the flu. Like why is that? Why are the cases so low compared to, say, last year? And I get that, like, the social distancing and the masks, people are doing all these things, but the COVID one is still rapidly spreading. How come the flu isn't?
Yeah, I mean, there's a few reasons for that. I mean, I believe the main one is the social distancing and the wearing of masks. I mean, that's how influenza is transmitted. Mm-hmm. And certainly that is kind of shaping what we see in terms of influenza cases now. If you looked at our summer, which would have been the winter in the Southern Hemisphere, they had very minimal cases of influenza this year, or this past year. And so that was a sign that we were also going to have limited influenza cases here as well. Now, if any doctor right now in our hospital, orders a test for influenza, mm-hmm. they automatically get a test for COVID, but not vice versa. They order a COVID test, then a COVID swab is done. Now, there's some limitations or restrictions or exceptions to that, but we can easily differentiate COVID and influenza. So from the lab perspective, the lab is able to detect influenza just as easily as it did last year before COVID. Now, it's possible that when COVID is causing a high rate of infections, that those people, because they're infected with COVID, they can, rarely can you get a second virus infection at the same time. You usually get one virus infection at a time. So perhaps that could be a reason why there's less cases of influenza. But I believe the main reason is the social distancing and the wearing of masks and hand hygiene and all the other things that people are doing for COVID.
Okay. Now, what are the chances that, I also read that with, say, the common cold, when somebody tests positive for COVID-19, I spoke with an epidemiologist and she told me the test was only accurate at 72%. Is it possible that they're not picking up COVID-19 in the test, like in a positive result, and they're picking up something else, like a dead form of coronavirus?
Yeah, so the detection method for COVID-19 that's used in our hospital involves detecting the genetic material. Now, if someone is sick and they're presenting with an illness that looks like COVID-19, and we detect the virus genetic material, then that's highly suggestive of COVID-19 infection. If that individual has been sick for a while, but has been getting better, and we do the test and it's positive, it could be that they still have live virus in their system, or it could be that the genetic material for this virus is still detectable, but the virus is dead. Because the virus can still be found, weeks or even perhaps more than a month or longer after someone is ill. Doesn't mean that they still have live virus. We believe that it's probably inactivated or dead virus. Now, there are other coronaviruses, but the test that we use for COVID-19 is different than for those other coronaviruses. Now, no test is perfect. So depending on when someone becomes ill relative to when they're tested, how long they've been ill, other factors related to their health, that can dictate what the likelihood is of them having a positive COVID test. And it also depends on how well the sample was collected and from where. Was the sample collected from the nose or deep into the nasal area, or from the throat, or from another location? And how well was the sample collected, and how much virus is located at those sites? Those will also dictate whether someone has a positive test or not. The actual technology for detecting COVID is very sophisticated, but it's only as good as the sample, and it's also dependent. It's only as good as how the sample is collected, and it's also reliant on how unwell or sick the patient is and other factors related to the patient. So there will be cases where someone might have COVID and the test is negative. And that doesn't mean that the test is a failure. It just means that perhaps we can't detect the amount of virus that's on the sample. And, perhaps in future years, hopefully we don't, have to deal with COVID in the next winter season. But in future years, if we do have lingering issues with COVID, I'm sure the technology will be enhanced so that our detection rate will be higher. But the detection rate is pretty good. And it's very specific and it's very sensitive overall. It's not perfect. Early on, people were developing these tests. And so, during test development, there's always a higher risk of missing things than kind of later on in time when people have refined these tests.
Okay. What do you suggest for people to, apart from social distancing, like on a nutritional level? Are they just vitamin D one of those things that actually work? Is that a misconception, or have you heard anything about that, supplementing with vitamin D and zinc?
Yeah, many things have been either studied or discussed. Vitamin D was found to be deficient in many people who had COVID-19 or died from COVID-19, but the studies have not shown that vitamin D supplementation does anything with regards to COVID-19. People have looked at zinc and melatonin and all these other things, but none of them really have played out as a way to prevent you from getting COVID-19 or to help you get better if you have COVID-19. So as far as we know, none of those are effective. Vitamin D has been looked at for many other diseases, and it hasn't really been shown to be effective as well for other things. It has its own purpose and usefulness in osteoporosis and other things, but for infectious diseases, it really hasn't played out as a treatment worthy of consideration.
Hi, Dr. Elsayed. My name is Dara. I'm the producer here with Jamie.
Hey,
and I just wanted to ask quickly, with the mutation of COVID, it seems like every 3-4 months there's a new variant, South African or, the UK version. And with the vaccine, and you said, maybe the South African, they're not sure if it's going to be responsive to the vaccine. I'm going to imagine that some people might feel then, is the whole vaccine just a hullabaloo where certain variants just will survive? Basically, the virus will adapt, and we did all the vaccine for nothing. Is that a possibility? Is that a concern? What are your thoughts on that?
Yeah, it's a very good question. I still think that vaccination will be an important strategy. We don't know how well vaccination is going to work in the long term. Again, these vaccines were developed very quickly, and the study participants were only followed for a very short period of time. So how long the immunity will last, we don't know. We do know that if you have natural infection to COVID, your immunity may last anywhere from 3 to 6 months. And those individuals, if they get the vaccine, may or may not benefit from the vaccine because, again, they already have protection from a natural infection. And so for many infectious diseases, so if you had chickenpox naturally, you don't need to get the chickenpox vaccine because you're immune naturally. Now, in terms of variants, other vaccines we use, like the meningococcus vaccine or the pneumococcus vaccine, many of these we give to kids, some of them we give to adults. These vaccines also are targeted to multiple types of those bacteria, but not all of the types. There are many circulating types of the pneumococcus bacteria. It's a bacteria that causes pneumonia and meningitis. There are many types that are covered in the vaccine, but many strains are not covered by the vaccine. And so when we saw these vaccines first deployed, they were able to reduce the rate of infections caused by those strains that responded to the vaccine or that were targeted by the vaccine. But then we saw an increase in infections with the strains that were not covered by the vaccine. But overall, the rate of infections dropped. And so many vaccine preventable diseases that we have vaccines for, we target the main strains that are circulating, but we can't target everything. And so there's a little bit of a blip with the ones that we don't target. So let's say we implement COVID vaccines that are good enough for the main circulating strain that's circulating around the world. It works against perhaps the United Kingdom strain, but maybe doesn't work very well against the South African strain. That doesn't mean that the South African strain is going to dominate the whole world. Because there are so many minor genetic mutations in other COVID strains, and there are, mutational development is an ongoing process for COVID. And there are many factors besides vaccines that will dictate how COVID spreads amongst the population. The social distancing, the masking, those will also serve to be ways to protect us against all types of strains. And so I don't think vaccination is futile. I think there's a role for vaccination. I certainly believe that people should have the individual right to decide whether or not they have the vaccine rather than to be forced to have the vaccine. Mm-hmm. And we won't know until months or years from now how well these vaccines played out.
And then just, based on, what you said, would that mean then in theory that if more people get the vaccine sooner, that the idea you could suppress COVID, like you don't have to deal with as many mutations, so maybe more likely it'll be more successful? Did that make sense the way I asked that?
Yeah, I mean, COVID is like a raging fire. And basically, if you could put like fireproof material around the fire, which is your face mask or your surgical mask and your social distancing and your vaccines, I mean, at a population level, you're exactly right. Giving vaccinations early will help fight the COVID pandemic better than giving vaccinations later. I mean, we don't even know whether the vaccines now will have an impact until the fall, because again, the impact of the vaccine, if someone on an individual basis receives the vaccine, they may have protection for, let's say, 3 to 6 months. We don't know how long. Mm-hmm. But if you have many people in the population who are protected, then the COVID viruses can't spread very easily from person to person, especially if they're wearing masks and they're having social distancing. So early vaccination will be very important. Now, some countries have been quick to jump into COVID vaccination and other countries are very slow. Now in Canada, we have many freezers that are housing these vaccines, but our deployment strategy has been dismal. And the governments have acknowledged this, and they want to ramp up the vaccination of the population, especially high-risk people. But I believe if vaccination is going to be implemented in Ontario, which it is, it has to be done at a much faster pace than what's happened. And we shouldn't restrict vaccination to just high-risk individuals. I think anyone in the population that wants to get the vaccine should have access to it. We have to have a better strategy for deploying the vaccine. Again, if you just limit the people receiving the vaccine early on, the impact is going to be very minimal on a population level.
So I just have one more. Oh, go ahead. Yeah. I was just going to say, I have one more question, then I'll kind of leave you guys. But, I've seen some reading that some experts might suggest that, people who are higher risk, like maybe diabetic, shouldn't get the vaccine. Or they're not sure because they weren't in the initial tests of the trials. And I just want to know what your thoughts on that. I think some people feel, well, then what's the point? Aren't they the people who need it the most? I guess what are your thoughts on that? Is that true? Should they not be getting it? What does that look like?
Yeah, so certainly many of these vaccine trials enroll people who are previously healthy or don't have a lot of medical illnesses. So for instance, in the vaccine trials that were done for COVID and for other viruses, they often don't include very young children or very elderly people or pregnant people or people who have other health problems. And so does that mean that you cannot use the vaccine in other populations? And the answer is no, it doesn't mean you can't use them. Individual judgment is required. You have to look at the risk benefit. Is this person a healthcare worker? Do they have other illnesses that if they get COVID could put them at, high risk of death? So if their immune system is weak, if their diabetes is very out of control, with having COVID, put them at risk for a very serious outcome. So you may have heard in the news that many pregnant people that work at some hospitals were refused vaccine because pregnant women were not included in the trials for vaccination. Mm-hmm. But does that mean that pregnant women cannot get the vaccine? The answer is no. That would be an individual decision. Now, I personally don't know whether vaccines should be given for COVID to pregnant women. But again, if it's being offered and to the general population and a pregnant woman wants to have it, that should be her own individual right to get the vaccine. But again, whether or not we don't understand perhaps vaccine safety in pregnancy very well with these vaccines, but as far as we know, there's nothing to suggest that women wouldn't benefit if pregnant. In my personal opinion, I would probably say that if you can avoid getting vaccinations in pregnancy, that would be great. But if a woman wants to have the vaccine, I don't think that request should be refused, especially if that person is a high risk of getting COVID.
Okay. Now, I know you have to run. Can you just give us some sort of glimmer of hope here, something to run away with in the future? Like, what are your projections of this whole thing? Do you think we're going to get through this? And how long do you think it's going to take before we're back to some sort of normal life? Or is this normal life going to be our normal life from now on?
Yeah, I mean, I hope this isn't normal life from now on. I don't think any of us know how long this pandemic is going to last and when it's going to go away. I do believe that things will eventually get better. We may have bumps on the road, if you want to put it that way. Winter season is usually a season where there's a lot of transmission of respiratory viruses. A lot of this is related to being indoors during cold weather. But certainly with the bubbles that we form with our families and perhaps with our work colleagues, I guess, and with a greater emphasis on social distancing and personal protective equipment, I think that we will get through this. The vaccines, I don't think will have much of an impact early on, but I think they will eventually if the pandemic drags on for a lot longer. The lockdowns, I'm not sure that the lockdowns will have any significant impact overall. And the lockdowns, as we discussed earlier, they have to be more vigorous, and they need to incorporate restrictions on international travel to a very high degree. Can't have leakage of international travelers into the country who are not monitored if you're going to have a lockdown for your own residents. So I don't think that the lockdowns being implemented by the government here in Ontario or in Canada or elsewhere in other jurisdictions have worked, except for island nations like Australia, where international travel was really restricted, and the requirement for people who are coming in as international travelers was a lot stricter than it is, for instance, in Canada.
No.
But I do believe that we'll get through this pandemic. If you look at some of the geographic areas in the tropics, if you look at per capita rates of COVID, for instance, in Florida and other places, it's a little bit less than some places in Canada. And a lot of that has to do with the warm weather. So the virus doesn't survive for a long time in hot weather. But I believe as summer comes along, we'll have a kind of a better situation. And hopefully by that time, the pandemic will die down. Now, this virus will probably remain with us forever, but not at the very high levels that we're having right now.
Mm-hmm. Okay. Doc, I think you got to run, right? Yeah,
I have a few minutes.
Oh,
I have a few minutes. Yeah.
I was just gonna ask then, in general then, because you're taking, you're giving a very measured approach to everything, the vaccine. As a general, do you recommend people consider it, or are you really, in general, do you think it's going to be helpful, or a little bit not so optimistic on it?
Yeah, again, it's very difficult to know what to say in that regard. It should be an individual decision. Now, certainly, it's going to be an important strategy in the long term. In the short term, the masks and social distancing are going to play the biggest roles. And so the vaccination without social distancing and masking isn't going to be very effective. It has to be combined. It's an adjunctive measure, if you want to put it that way. Some people feel that it's going to be our main measure long term. I personally believe that masks and social distancing are more important than vaccination, if you want to put it that way. But vaccination will be an important strategy. And certainly, so far, the people that have received the vaccine have not had any issues, except for a few rare allergic reactions. And again, there are a lot of unknowns. It should be up to the individual person to decide for themselves whether or not they want to take the vaccine. I think if you work as a healthcare worker, there may be a greater push to get the vaccine, or if you live with someone whose immune system is suppressed to get the vaccine, that individual may want to get the vaccine. Just like anything else, we have other medicines or vaccines that are approved, and perhaps not as quickly as the COVID vaccine, but we have other medicines and vaccines that are approved all the time. And we don't really know what the long-term potential harms are with those medications until later on in life. And so there's always a risk with taking something new, and it doesn't matter whether it's a medication, it could be a new food, it could be a new vaccine. There's always a risk. But so far from what we know, these vaccines seem safe.
Now, do you remember back when we had SARS the first time? Now, that one just disappeared. How did that happen?
Yeah, I mean, it's kind of, it's part of the same family of viruses, as you know, and it originated from almost the same geographic area, not in Wuhan, but in southern China, Hong Kong. And there were, cases around the world. We had, obviously cases in Toronto. We had a number of deaths in Canada, but nothing compared to what we're seeing now. The death rate for SARS was higher than, the death rate for COVID. There are many unknowns and as to why that one disappeared and why COVID-19 isn't disappearing. I can't really say why. I mean, there are some hypotheses about this. I mean, one of the things that we've done differently this year with COVID-19 or with 2020 is that the surveillance and testing has been so extensive across the entire globe, much higher than for probably any other virus that we've ever seen. And so the case counts that we have are probably biased in that regard because we're testing everyone. We're even testing people who don't have symptoms. Whereas if you go back to SARS, we weren't testing asymptomatic people that didn't have symptoms of the disease. We weren't doing mass screening. But then again, it was restricted to one geographic area. It hadn't spread, across Canada. Was found in different countries, but it was limited. And perhaps it was just due to the behavior of the virus. That particular strain of virus perhaps didn't spread as well as COVID-19 did. Mm-hmm. So it has to do a lot with the actual virus. It could have been due to the climate at the time. We have more air travel now than we did back when SARS happened, 2002, 2003. So, 17, 18 years ago when SARS happened, we have a more connected world than we did before. So that could play a role.
Now, with the mortality rate with COVID-19 being so low, why do you think why is everything so ramped up? Like that's the biggest argument people say is like, yeah, you get it, but the chances of you dying from it are so slim. When you look at the numbers of things, and I think that's what are getting people all worked up because if it was killing half the population, I think people would be thinking differently. So they're more apt to gamble with not social distancing or wearing masks and hand washing, which obviously keeps the spread going. But with it being so, why is this one so different?
Yeah, I mean, obviously there was a lot of panic when cases were reported in many different countries around the world, especially with patients in Europe, in Italy, in Spain, in France, and UK, and in the Middle East, in Iran, and obviously in China. There were a lot of deaths early on. The case toll in Italy was very concerning. I mean, they had people who they couldn't put on ventilators because they just didn't have the capacity to resuscitate people that were dying of COVID-19. Now in Italy, they had a population of very elderly, otherwise healthy men. So the people who were dying of COVID-19 in Europe were primarily older individuals. Now, the same thing in other places around the world, although, we have had some young individuals succumb to the illness or have had some symptoms linger after they recovered from COVID. But I think this is the first time ever that we've had anything this massive in terms of case numbers. The media also is playing a role in, I believe personally, in creating fear from COVID because of, everything in the news is about COVID and the case numbers, et cetera. So I think that's helpful in some ways to better our understanding of what's going on, mm-hmm. but it could be having a negative impact on our mindset with regards to managing COVID. There's a lot of, stress about COVID, a lot of mental health issues, a lot of challenges for people being restricted in what they can do. And so that also plays a role in how we look at the current pandemic. But the death rate is lower. The actual death rate depends on what population you study, because again, the rates are higher in older people and they're lower in younger people, and different numbers have been thrown out. Some people have said it's as low as 0.1%. Other people have said it's higher than 1%. But it depends on the patient population that you're studying. Not everyone has the same risk of death if they get COVID-19. The older you are, the more likely to die from COVID-19. The more health issues you have, the more likely you are perhaps to die from COVID-19. The more suppressed your immune system is, the more likely you're to have a problem with COVID-19.
Okay.
And the other thing that's concerning is that this infection is not restricted to anyone. It can infect anybody in the world. And so that's the biggest panic. Whereas certain other infections might relate to certain practices or behaviors and or occupations, etc., and perhaps get less attention and less concern.
Okay. Well, listen, you've been very honest, and I really, really, truly appreciate you coming on and taking the time out of your busy schedule to just give us some sort of insight and make us feel better, or maybe make people feel worse. Who knows? But
more cautious.
More cautious. But I appreciate everything you're doing as a frontline worker, and for everything that you're doing for the general public. And appreciate you coming on.
It was a pleasure. Thanks, guys.
Okay. Thanks a lot, Doc. I appreciate you. Have a great day. Take care.
Bye-bye.
Bye-bye. Want to give a shout out to Devolution Productions. Devolution Productions is the production company I use to produce my podcast and to do a lot of my fight-related stuff. The absolute best production company I've had the opportunity to work with. And if you're looking to get any work done or any kind of videos or anything professional, Devolution Productions is the company to contact. To get a hold of them, just inbox me, shoot me a message, text me, call me, Facebook, Instagram, anywhere, any of those handles, and I'll connect you in a heartbeat. Devolution Productions is, bar none, the best production company in Canada.